Dr. Jones, and this is Dr. Pearlstein, and we're again discussing some of the concerns that the ICA posted about our bill here in New Mexico. And one of their concerns was that chiropractic is a drugless profession. And I think we need to discuss drugs in society. I think we all agree that drugs are dangerous. Drugs kill a lot of people. So the question is, where does drugs fit in the healthcare realm? Where should they be placed? Should they be the first thing that we do with the patient or the last thing that we do with the patient? And I think though we were trying to say, and what we would accomplish as a profession that could prescribe some medication, is that it would be the last thing that we do.
Exactly. I don't think it is terribly realistic to have a no drugs policy, because I'll bet you that some of the most fundamentalist chiropractors, when they are suffering in their last dying days, are going to beg for some drugs because it's appropriate at that point, and maybe some drugs to intervene in illnesses that have gone way too far. So I don't think the argument should be about whether drugs should be ever used, but where do drugs fit in our society? Both Rob and I agree that drugs are abused, overused, inappropriately used, and create a heck of a lot of problems, in many ways more than they solve, especially with controlled substances. They're a scourge to humankind, and yet drugs also have a positive side in that they heal and they're helpful when used judiciously. Our point is, who best to use them? Those who are anti-drug or those who are pro-drug? Something to think about.
Yeah, I think that there is room for our profession to move into some limited prescription authority. I think the Dynamic Chiropractic did a poll on that, and every poll that I've seen, our profession has stated that they want some limited prescription authority. And I think primary care limited prescription authority. Now we're talking about things like non-opioids. We're not talking about the controlled substances that people are getting addicted to, which is what the ICA have been misleading the people that we're looking towards to. We're talking about basic primary care medication that if someone came into your office and you weren't able to help them with the nutraceuticals, with lifestyle changes, with coaching them to eat properly, sleep properly, exercise properly.
And with chiropractic.
And with the adjustment, which is extremely powerful. There comes a point in time when we need a little bit of help. And that's when we would use it. We cannot ignore the fact that our patients are in that world right now. And so we even have patients who come into our office who we should be taking them off the drugs. And then we can help them. People who are just starting to take metformin because they just come over to the area where their hemoglobin A1C is a little bit over 5.6 or 5.8, and they're now put on metformin. They're not even discussed by the other professions about how to exercise, how to eat. We as a profession can't say you can't take those drugs because we can't prescribe them. This issue is a lot more complicated than just drugs are good or drugs are bad.
Right.
We're anti-chiropractic, we're anti-medicine. That's the whole issue that's being tossed around now. There is so much gray in between that as a responsible, growing, adult profession that we are, we have to address it. And I think that the mainstream of chiropractic is looking at this issue, and we need to continue this discussion. And I think our bill had all the solutions to this discussion in a very succinct, safe, and integrated manner with all our other colleagues out there.